I'm Dr. Anthony Maloof of Eyes and Faces and Cornea and Ocular Plastic Surgery in Sydney, and welcome to this video on eyelid heaviness, one or both, and how to tell the difference. Patients come in all the time for all different reasons and say, my eyelids are heavy, I'm tired, they're droopy, and we tend to use words and mix them all up. And that's fine, that's how our brain works, and people give us words and they say, oh, you've got heavy eyes. So patients say, I've got heavy eyes, but what does that mean? And they really have trouble distinguishing them. And my role is to try and help them understand the mechanism of their symptoms so they can then better decide what to do. It's actually not difficult. Generally, people with heaviness of the eyes have a fullness below the brow, and you can see it, a photo in the mirror. That fullness is often genetically determined and gets worse over time. But underneath that, you've got an eyelid, and that eyelid could be droopy. So how do you work out the differences in symptoms? Generally, heaviness is there throughout the day. So if you've got a heavy subbrow region, it'll be there throughout the day. You'll see it in pictures. The droopiness gives you symptoms of tiredness that tend to get worse throughout the day, particularly with visual tasks. So in the afternoon, they'll say, I'm so tired, I can't open my eyes. I need to have a nap. Everyone says to me, I look more tired in the afternoon, but I feel better in the morning. I take photos and my eyes are uneven. That's usually droopiness. As we get older, most of us have a combination of both. And it's about what is more of a problem, and that decides what I tend to shift my emphasis on. Here's what you can do at home, very simple. Just grab the skin under the eyelid and lift it up. Don't pull on it and stretch. You can lift the brow as well. And if that gets rid of the heaviness, it's probably the skin under the brow. But generally, it doesn't get rid of the tiredness. You tend to have to do that, and that's usually droopiness of the eyelid. So all these symptoms can be due to a fullness, a heaviness under the lid, excess skin, excess fat, previous thyroid disease can do all these problems, or it can be due to droopiness. Simply that little lift at home will help you decide what is the predominant component to your symptoms. Here's a tip, when people come in over 50, generally they have both, and I have to lift and get rid of the heaviness. I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces of Cornea and Ocular Plastic Surgery in Sydney, and thanks for watching.